All right, I think I may be all set to go if everyone else is.
I say you're good to go whenever you're ready.
Okay, excellent. Well, good morning, everybody. Thank you very much for the opportunity to be able to present as a part of this virtual Discovery Days. And I'm grateful for the opportunity to be able to talk with each of you a little bit more in depth about various careers that exist within the field of veterinary medicine. And then towards the end, we've got a fun case study to be able to cover. I know one of our veterinary medicine students, one of our second-year students, was supposed to join us this morning, but had an emergency at one of the clinics where she works. And so I know she was supposed to join us, but that's where I'm going to do my best to help cover a little bit about not only various careers within veterinary medicine, but also help us run through a case study that kind of helps start thinking about the analytical thinking and critical thinking processes that go into being an effective veterinarian. So we'll be able to go through the presentation, and then towards the end, we'll have some time if you want to be able to send some questions via the chat. We can be able to cover those questions as well. But if that all sounds good, what I'm going to do is to share my screen here. So give me just a second to get that all taken care of. Okay, so if everything is working according to plan here, you should be able to see the first page of the presentation here. And again, as noted, my name is Dave. I work within the Office of Admissions here for the College of Veterinary Medicine at Kansas State University. And I'm thrilled that each of you, you're not only willing to be a part of this virtual Discovery Days, but that you're willing to spend an early morning here with me talking a little bit more about some of the unique career opportunities inherent to veterinary medicine, as well as giving you all the opportunity to be able to ask questions about not only getting into veterinary medicine, but how you can get involved with some of these different career opportunities. And again, as noted, towards the end of this presentation, we'll be able to cover a little bit more information as it relates to anything that you may have. So as we dive in, we talk a little bit about, so where are some of the areas that not only our students, but our graduates are going towards after they complete what is commonly known as their DVM, their doctorate in veterinary medicine? Where are some of the career opportunities where they're going? So kind of starting off with a good percentage of our students will enter some kind of employment, a contract with a private practice or a clinic. So for the most part, these private practices and clinics, for the most part, are focused on small animal care, but there's also mixed medicine practices and those that work within specific fields of medicine. That's where, for the most part, within these private practices and clinics, you're going to have various routine services, you're going to have wellness exams, and a variety of vaccinations that are provided to an array of patients that make their way into the clinic. You're also going to have nutritional counseling, and so that's where folks can be able to bring in their patients, and the veterinarians can be able to work with them on what the best approach may be just in terms of nutritional and dietary consultations. So that's where within these practices and clinics, you're probably going to see a higher volume of client and patient visits depending upon the area in which you live, as well as the different resources that are available within that area. Not only that, but because recent studies have shown that about 2/3 of American households own some kind of pet. So you're going to be working with a lot of different individuals, a lot of different folks from a wide array of backgrounds and experiences that own pets that as a veterinarian, you would be working with and connecting with. And as I'd alluded to earlier, you also have these mixed medicine practices. So you might be living in different parts of the world where you're going to be connecting with individuals that may have companion animals that live at home, but then have maybe cattle or sheep or llamas or any number of pets that may live within their property. So mixed medicine practices are able to cater to individuals that have companion animals as well as larger animals as well. That's a little bit about some of the different private practices and clinics. You're also going to have the opportunity as a veterinary medicine graduate to start looking at different internships and residencies. So what this means is for individuals that are looking for specific areas of focus to gain even further knowledge. So if you're really interested in ophthalmology, if you're interested in dermatology, small animal, internal medicine, orthopedic surgery, things like that, that's where after graduating with a DVM, individuals can be able to seek out an internship, which is usually only about a year or so, and they can work with a participating clinic or one of the 30 veterinary medicine programs across the US to be able to gain a little additional experience. Or individuals can look at what is called a residency. That's usually a little bit more in depth, and those are offered here and at the 29 other fully accredited veterinary medicine programs throughout the United States. Now, what happens during kind of that 3-year time frame is that you're usually under the direct supervision of somebody who is a board certified fill in the blank. So it could be a board certified oncologist, radiologist, cardiologist, but as a resident, you would be a doctor of veterinary medicine serving under that board certified specialist, working towards the completion of an exam similar to the one to become a certified veterinarian. You would take a specific set of board examinations to be able to be a board certified cardiologist, oncologist, radiologist. And so that way you can be able to, as you are going through that 4th year in the veterinary medicine program, figure out what the next step may be in terms of an internship or a residency to be able to gain specific interest areas and gain that experience to work towards board certification within those specific areas. So that could be another pathway that you choose immediately after completing your DVM. You can also work towards a field of equine medicine. And so there are lots of different areas of focus specifically in working with our equine patients. So that's going to include everything from internal medicine to surgery to theriogenology and lots of different areas in between, focusing specifically on equine patients. Within internal medicine alone, you could be looking at respiratory challenges that equine patients may have, looking at the GI tract, looking at the nervous system, muscles, organs, being able to gain that kind of composite picture that when a client brings in their patient, you're able to effectively diagnose what the challenge may be with that particular patient. As a part of our program here, you also may have field service opportunities. So that's where if a client can't always easily bring a patient to the hospital, we can be able to bring parts of the hospital to that patient as a part of our field service units that our faculty serve on, as well as our 4th year students when they're going through their clinical rotations here within the program. And we also have the facilities to be able to offer performance and rehabilitation medicine. So that's for working with equine patients that might be a little bit more on the performance side. We're able to offer a variety of services and programs for those patients. You're also looking at opportunities within food animal medicine. So especially here in the state of Kansas, the importance of both beef and dairy cattle brings opportunities for our students and our faculty and our veterinary medicine graduates to be able to connect with a wide array of clientele across the state. Now, areas within this specific component can include farm animal production, as well as welfare and nutrition, making sure that they are healthy and well taken care of. Looking at the fundamentals of feedlot management. So there are classes and courses that cover the business component of being able to manage feedlots, both large and small. Looking at diagnostic methods of feedlot management. So being able to connect with other ranchers, veterinarians, constituents, being able to provide them the best care possible, knowing that food animal medicine, especially within beef and dairy cattle, provides such an important local, nationwide, and global impact in terms of the services that are provided from those kinds of individuals. So being able to connect with a lot of different constituents to be able to provide those kinds of opportunities. State and federal assignments. So these are unique opportunities that DVM graduates can have that may not be as, I'd say, present as, say, like being able to work or own or operate your own clinic, but they are definitely important nonetheless. It's suggested that no fewer than 1,200 DVM graduates are working for the federal government in some shape or capacity. So you could be a veterinary medical officer within the armed forces. You could work as a food safety and inspection specialist within the USDA. But then you're looking at programs within the Department of Defense, Health and Human Services, as well as the National Institute of Food and Agriculture within the USDA. So between the FDA, the CDC, the NIH, lots of different organizations that hire and bring on veterinarians to do a wide array of tests, of studies, developing programs to be able to kind of focus on what's known as the One Health Initiative. So that's looking at the combination of human health, animal health, and environmental health, and what we can do to be able to positively impact all of those various arenas through these different state and federal assignments. Speaking a little bit more about opportunities inherent to working as a medical officer within the armed forces. So that's where we have several of our students that are a part of a program where they're going to have the opportunity after they graduate with their DVM, they are going to be an active duty officer within the armed forces. A couple of them are looking at the Army, where they would be stationed at an active Army base where they would be able to have the opportunity to serve as a food health and safety specialist. They would be able to work with those that are stationed at the base in terms of companion animal health and medicine, as well as mentioned previously in the last slide, potentially working with the Department of Defense, with Health and Human Services, being able to really focus on a lot of different areas and components. And for those students that are a part of these different programs, there are usually significant scholarships and benefits that are a part of these positions serving as a medical officer within the armed forces. One of our students will have his second, third, and fourth year of veterinary medicine entirely paid for by the Army as a part of being within a program to where he will graduate, be commissioned as an officer, and then serve at an active military base somewhere here within the United States. So there are definitely exciting opportunities that are available to look into being a medical officer within the armed forces. You can also get involved in a variety of programs that focus on teaching and research. So if you enjoy your time within a veterinary medicine program, that's where you can have the opportunity to perhaps come back and teach a variety of different subjects that are offered within the program. So for instance, within the first and second year of a veterinary medicine program, you're not only teaching different classes as it relates to clinical skills, as you see going on in the photograph here, but you're also going to focus on anatomy and physiology. You're going to be focusing on diagnostic medicine and pathobiology. And then especially during second year, what our students refer to as all the fun-ologies. So that's everything from toxicology, parasitology, cytology, clinical pathology. And so that's where during that second year, you're kind of learning where everything starts to kind of go awry and why we need veterinarians, is that all these different anomalies and discrepancies that we recognize in patients, being able to provide a wide array of services for our clients and our patients within the field of veterinary medicine. And that's where you could be a part of different research projects, or you could help teach classes at veterinary medicine programs that are located throughout the United States and really across the globe as well, just because there's so many different subjects that are either taught or there's research conducted at a program here like the one at K-State. So exciting opportunities from a teaching and a research standpoint. You also have opportunities inherent to the field of extension and communication. So as a land-grant institution, K-State, as you very well may know, K-State has an office in every single one of Kansas's counties. And so that's where, as an extension and a communication officer, individuals that have their DVM could be a part of efforts that help support county agents. You could work with other practicing veterinarians in terms of best practices, as well as connecting with constituents regarding the sustainability of livestock producers in those different counties throughout the sunflower state. And so that's where knowing the backbone of the economy of the state of Kansas, health management in terms of that One Health initiative, where human health, animal health, and environmental health all combined within the same component. That's where here within the state of Kansas, that's going to be the primary focus. And so that's where those extension and communication officers work with a variety of constituents and individuals to be able to provide those services to ensure the health of the Kansas economy. And so in addition, you are given the opportunity to create programs and education focusing on health management, sustainable habits and attitudes, as well as the activities that go on as it relates to that One Health initiative. So as a DVM and as a graduate, you could be working within the K-State Extension and Communication Office, being able to have a positive impact on counties all throughout the Sunflower State. This goes back to talking a little bit about the research component, but that's where, in addition to research that you can be able to conduct with a university or with an educational program, there's also the opportunity to be able to focus on working with public and private companies on the more industrial side of research and development. So this can be able to focus on anything related to nutritional components for companion, equine, exotic, and livestock animal health. This can focus on the production of vaccinations and other medications and other products as well. This could be able to focus on preventative measures related to fleas, ticks, and other parasites that cause harm to our small and large companion animals. That's conducted within facilities that are meant for manufacturing and distribution. So for example, we have one of our now third-year students here within the program that her background was in biological engineering. And so that's where this particular student is going to take that background within biological engineering and to be able to take a look at, how do we, on a larger scale, if we are working with the production of a vaccine or a medicine or a treatment, being able to create one version of that is incredible, but being able to create that tens or hundreds of thousands of times in an effective and efficient manner is going to help revolutionize the way that we provide treatment and medication from that particular standpoint. And so that's where, from an industrial research and development standpoint, we have different partnerships with a variety of companies and constituents in terms of helping students be aware of some of the opportunities that are out there from a veterinary medicine perspective. So I can't tell you much about it because I quite literally signed a letter to where I wouldn't disclose a whole lot of information about it. But about a year ago, I had the opportunity with some of our third-year students to take a behind-the-scenes tour of the Hills Research and Manufacturing Plant in Topeka, Kansas, where they conduct a wide array of research as it relates to providing a variety of nutritional products for our companion animals. And the amount of research and development and focus that goes into providing a lot of different nutritional products is phenomenal. And that's where veterinarians can be able to have a positive impact in terms of what we feed our members of the family from that perspective. So lots of unique opportunities from that perspective within the field of industrial research and development. Admittedly, this is one of our more popular options within our program here at K-State, and that's where, because of, as you see, Dr. Carpenter here with his fourth-year students that are on the exotic animal rotation, that's where we have our own office and facility within the hospital that focuses on zoo and exotic animal practice. Now, I will be forthwith with saying that being a zoo animal veterinarian is probably one of the most competitive, if not the most competitive field within veterinary medicine. I think professionally about one position opens up every 3 years. And I say that not to discourage, but to be able to provide a realistic outlook in terms of what opportunities are available within zoo animal practice. But with exotic animal practice, depending upon the clinic or the environment in which you work, you could have the opportunity to connect with a wide array of non-traditional pets that individuals may have as a part of their family. So within the veterinary health center, that means we've had the opportunity to work and interact with a variety of patients, including hedgehogs, guinea pigs, birds, reptiles. I think one of my favorite examples was several years ago, our faculty was able to successfully implant a pacemaker in a ferret known as Princess Zelda. I think that's one of my favorite client-patient stories. And Princess Zelda went on to have a fairly long and prosperous life, just recently passing, but she was able to live for about another 4 years after having that pacemaker successfully installed. And so that's where, as a part of the zoo and exotic animal field, students here at the program can be able to gain a variety of experience working with the U.S. Fish and Wildlife Services, providing care to sick, orphaned, or injured wildlife that are either brought into a clinic or brought here into the hospital. And that's where being able to work with such a wide array of birds, reptiles, our students are able to provide exams and different surgical services. Again, as mentioned, with our faculty having such a tremendous background with the Fish and Wildlife Service. Additionally, we have a strong and vibrant herpetology lab here within the program where students can be able to care for a variety of patients that have been with us for a number of years. In fact, we have Edna, a blue-tongued skink that, believe it or not, is as old as I am. And so she's been at the hospital here for a few more years than I've been here in the admissions office, but we're the same age nonetheless, which is a testament to both of us. But that's where within that zoo and exotic animal practice, there are tremendous opportunities to be able to work with those individuals that are given the opportunity to work with a wide array of patients and clients at the end of the day. Additionally, a growing area of focus within veterinary medicine, and we were actually able to earlier this academic year unveil a specifically focused area within shelter medicine. And I'm tremendously proud of what you see in the photo here, and that is what is known as our mobile surgery unit. And so this is an opportunity that when students are in their 4th year of the veterinary medicine program, so similar to high school, our veterinary medicine program, you're going to have 1st, 2nd, 3rd, and 4th year. So during that 4th year, our students are spending 2, 3, and 4 week clinical rotations throughout different sections of the veterinary health center here on campus. And one of those 2-week rotations is being a part of what is called the mobile surgery unit. So you may have seen this out and about in the community, but the mobile surgery unit takes faculty and 4th year students to shelters within about a 2.5 hour radius of Manhattan, goes to shelters that don't have a regular veterinarian on staff. And those students will perform complimentary spays and neuters for the patients that are located at those shelters, which helps make them more adoptable at the end of the day. It's a very cost-effective way for those shelters to have those procedures taken care of. And it provides tremendous experience for the 4th year students that are a part of those particular rotations. And so it's a great way to be able to help serve the community and provide unique experiences for our 4th year students that are within the program. So the shelter medicine program is very community-based. It's about getting out into the community and providing those kinds of services for those shelters. It's about the civic responsibility that veterinarians have to their communities and to their clients and constituents. And so that's where, for the most part, it's providing that preventative medicine through spays and neuters and other procedures, as well as it serves as being an advocate for the welfare of those individuals that are within different shelter environments. And it provides the opportunity for our students, faculty, and for our graduates to be able to develop these partnerships with local and regional facilities to be able to provide that crucial care and support for a wide array of patients that find themselves within that shelter atmosphere. So it's a relatively new area of veterinary medicine, but one that is definitely growing from that perspective as it relates to being able to provide that veterinary medicine care at the end of the day. So I believe with that, we are going to kind of make our way into the case study. But before I get to that point, and I can actually open up the chat here. And so before we kind of dive into the case study, and we can definitely cover a few questions as it relates to those different career opportunities that I was able to cover. So it looks like the first question that came through the chat here. So what do you do with the orphaned exotic animals? And so a couple examples that we do. So if they are exotic, or especially if they're wildlife. So I know rather recently, Dr. Carpenter was able to successfully conduct surgery on and help mend a wing of a broken eagle, a broken wing of a bald eagle that was brought into the veterinary health center. And so what we did is that we partnered with local representatives from the U.S. Fish and Wildlife Service, that after we were able to conduct successfully that surgery and the bald eagle was given time to mend, we were able to successfully release that bald eagle back out into the wild, and able to monitor to ensure that the patient was able to successfully ingratiate itself back into the wild. So that's just one example, but that's where for those that are brought in, we do our best to make sure that they are properly re-released back into their environment. The next question here from Susanna. So what is the most popular path grads take after getting their degree? And I would say that's where it's a really great question. And so that's where it's kind of split up into different sections. And so in the kind of the first third, you're going to have a third of them that are focusing on working within private practices and different clinics that either focus on small or mixed medicine practice, just because that's kind of where the demand is within the field of veterinary medicine. So about a third will look to go into small animal private practice, or mixed medicine private practice, or working within a clinical environment. Another third will focus on working towards either an internship or a residency program to kind of focus within a specific area of veterinary medicine. And then another third is made up of those that are getting involved in teaching, getting involved in research, are those that are seeking out working specifically with either large animal or equine or bovine medicine or exotic animal practices. So it's kind of broken up into three different sections where we see our graduates going as it relates to their progress towards graduation. So that's a really good question. So I've got to scroll up just a bit to get to our next question. So let's see. If I'm pronouncing it right, Elise, that's where in order to become an equine chiropractor, do you have to go through vet school first? And you'll want to be able to check with your state laws, but yeah, for the most part, if you want to be able to provide medicine and diagnostic services for patients within the field of animal health, you're probably looking at not only a DVM, but you're also probably looking at either an internship or residency focusing specifically within that area of equine medicine, especially as it relates to maybe chiropractic or being a chiropractor or anything kind of along that line. So it's just something to be able to keep in mind, that especially if you're not only wanting to work towards practicing veterinary medicine, but something specifically, it's just like in human medicine, to where if you want to be like a cardiologist or an internal medicine specialist, it's looking at kind of that initial veterinary medicine degree as well as kind of a specific area of focus. So it's just something to kind of keep in mind when you're looking at the length of time that you're spending within a professional program and what it takes in terms of experiences to be able to kind of get to that specific area. So that's a really good question. Um, let's see. Brady, Colby, and Kaysen had a question about can animals be moved from the wild to a zoo or shelter to heal and then be released again? Okay, so that's a really good question. So one of the most recent examples that I can think of is that there was a zoo out in western Missouri that had a newborn baby giraffe that, as it was born, was already about 6 feet tall, that within its first few hours of life actually broke a bone in its leg. And so that's where we were able to work with the zoo to successfully transport the baby giraffe named Tumbleweed here to the vet health center. We were able to perform successful surgery. We were able to keep Tumbleweed around for a little bit, provide some light physical therapy. And when Tumbleweed was ready to go, we were able to successfully transport him back to home and family out in western Missouri. And so that's where from time to time, we do have facilities and services here where we can allow patients to be able to heal, allow them to mend before taking them back to where they need to go, either back to a zoo or back out into the wild. So you guys are doing great, keeping the questions going here. Brady, you had, what are some good things to do to have better chances to get into the K-State vet medicine program? And so that's a really good question. And so if I'm understanding correctly, those that are participating as a part of the Discovery Days could be from middle and mostly middle and high school. There may be a few folks that are looking to head into college here within the next couple of months. But I would say that to help improve chances as it relates to being admitted to a selective program within veterinary medicine, what I'd really encourage all of you to focus on is kind of this three-pronged approach. And that relates to success in the classroom, success within veterinary medicine related experiences, and involvement in your community. So what I mean by that is, from our selection process, we look at how students have performed in what are called prerequisite requirements to the veterinary medicine program. So core undergraduate classes from biology and chemistry and physics to microbiology and genetics. And so that's where those core classes are such an important part of making that transition from undergraduate to a professional veterinary medicine program, that having a strong, you don't have to have a perfect GPA, but having a strong GPA tells us that academically you're ready for the challenge of veterinary medicine. That second part, you want to be able to accumulate both a quantity and a quality of veterinary medicine experiences. So this can relate to opportunities to either shadow or volunteer a local or an area veterinarian. This could be working at a shelter, but for the most part, you want to be able to build upon those hours where you are under the direct supervision of a veterinarian, so that you start to develop an understanding of what it takes in terms of interacting with a variety of clients, working with a variety of patients, and what a veterinarian means not only to their community, but to society as a whole. And then that third part is just being involved within the community. Show us that you've been purposeful in developing skills related to teamwork, communication, leadership, and some of those soft skills that tell us that you're ready to be an effective veterinarian that's ready to communicate with a lot of different folks. Because I sometimes hear when I go on my travels of somebody wanting to be a veterinarian because they don't like people and they love animals. Let me tell you this, 90% of being a veterinarian is communicating with people, because as we'll kind of cover here in the case study, you're going to have to gain a patient history. You're going to have to ask questions. And a lot of that communication focuses on the clientele in order to make sure that the patient is going to receive the best treatment possible. So those are some of the things that I would, Brady, encourage you to focus on: your academics, those experience hours, and getting involved in the community as a way to have a well-rounded experience from that standpoint. So it looks like the questions are starting to continue on. So I want to make sure to be able to cover everyone's questions. So I will do a better job of not being so long-winded here. So Susanna, you had a question about what do you need to become a vet tech? Is it 4 years? So for a vet tech program, while we don't have a vet tech program here at K-State, I want to say here within the state of Kansas, one of the closest ones is at Colby Community College out in Colby, Kansas, and they actually have an online program as well. That is traditionally 2 years, and that's where you can be able to work towards a vet tech, or what's also known as a veterinary nurse. It's a 2-year program where you can be able to work in a variety of different clinical settings as a veterinary tech or a veterinary nurse. So that's a 2-year program. And one of the closest ones here in the state of Kansas is found at Colby Community College. Let's see. Okay, if I'm pronouncing this correctly, Elena, you had a question. Is there a limit to the amount of students to get into the like the vet program? That's a really good question, and there is. So for the 30 veterinary medicine programs located throughout the United States, sometimes it's anywhere from 120 students, somewhere it's about 80. For us, we're kind of right in the middle. Every year, we admit approximately 112 students to our program that have completed the undergraduate requirements and have been admitted through an application and an interview process. And so it's about half Kansas residents and about half non-Kansas residents, just because when you have 30 veterinary medicine programs, not every state has an in-state program. So we get quite a few applicants from places like Texas, California, New York, and Pennsylvania that, despite having larger populations, each of those 4 states, California has 2, but the other 3 just have 1 veterinary medicine program. So we get lots of applicants, and we admit about 112, 115 students to our program each year. So really good question. Cecilia, you have a question about, are there scholarships that tie directly to vet med? And yes, there are. So I want to say the past couple of academic years, we've been able to hand out several $1 million of scholarships worth to our students in the 1st through 4th year in the program. And so that's where, when students are admitted, when they start the week of orientation right before the 1st year in the program starts up, that's where those students can be able to apply for those scholarships. And some of them are competitive, some of them are interview-based, some of them are based on previous experiences. But that's where we're able to offer, sometimes in the form of several hundred or several $1,000s to individuals as a part of scholarships that are tied directly into veterinary medicine. And that also could include any other external or outside scholarships that students bring with them. But we here in the veterinary medicine program do offer a number of scholarships towards our students, in addition to programs that help in terms of providing loan assistance or loan forgiveness if and when they need to utilize federal student aid to help cover the cost of their education within the program. So hopefully that answers your question there, Cecilia. Great one. Noah and Amelia, you had a question about in terms of veterinarians and what maybe their salary expectations look like. And that's a good question. When you take a look at the cost of education, you want to make sure that it's going to be worth your investment. And so that's where I would say that on average, graduates of a veterinary medicine program, depending upon where they go, on average is probably right around north of 75,000 a year. And so when you're looking at taking on a position within veterinary medicine, going through a professional vet med program, you want to be able to take a look at, where do I want to practice? What kind of job opportunities are there? And what does the cost of living look like within that environment? Just because you may get a larger offer in terms of salary, but if you're working within an environment that has a higher cost of living, you need to weigh that against maybe working within a smaller community that doesn't have as large of salary, but maybe your hours are a little bit flexible. Maybe you get to live a little closer to home. Maybe there's incredible benefits that are a part of it. So I would say that yes, veterinary medicine is while the cost is a significant investment, I would say it's an absolutely worthwhile investment for the financial incentives that are being a part of practicing veterinary medicine and being a certified DVM at the end of the day. Brady, Colby, and Casey, you had another question about can an injured animal move permanently to a zoo? And I would say that some of those instances, yeah, either a zoo or a sanctuary or a reserve, probably more commonly, is when some of those instances occur, especially if it's determined that a patient is brought in and successful surgeries or procedures can be taken, but perhaps that the opportunity to release them back into the wild would be detrimental to their health and well-being. perhaps it can be looked at to have various either shelters or reserves, areas where that patient can be able to be taken care of. I'm reminded of in Northwest Arkansas, there's a big cat reserve where about a year ago, we were able to successfully bring up a white Bengal tiger for an eye exam. And so we were able to successfully transport that patient from Northwest Arkansas here to our facilities and back. And that's an example of a patient that maybe couldn't necessarily be released back into the wild, but can live out a healthy life as a part of a reserve that is overseen from that perspective. So let's see. Okay, Noah and Amelia, I got the question answered about financial components. Let's see, Kaylee, you had the question about going to regular college before vet school. And so that's where there's tremendous flexibility from that standpoint. That's a really good question. And so yes, that's where we have certain undergraduate requirements to be admitted to our veterinary medicine program. They're located on our website, but as long as an institution is accredited, that's where you can be able to complete courses. So for instance, anything like Kansas State University, Fort Hays State, the University of Kansas, Baker, Pitt State, any of those different institutions, including a variety of community colleges located throughout the Sunflower State, are areas where you can work towards completing those undergraduate requirements. One of our now third-year students, Jason, it made more sense for him to spend the first 2 years out of high school going to Hutchinson Community College, where he lived close to home, he helped out on the farm, and he gained veterinary medicine shadowing hours, completing those undergraduate requirements. He did a third year here at K-State to complete the rest of them before being admitted to the veterinary medicine program. So you don't have to feel like you have to be a square peg in a square hole to be able to be admitted to a veterinary medicine program. But yes, there are certain undergraduate requirements that have to be completed, but you can utilize a variety of institutions, community colleges, small and large universities to be able to complete those requirements from that perspective. Cole, you had a question about how many years of school is needed to work at an animal health center. Okay, so let's say that you have just recently graduated high school and you're looking at making that jump to high school to an undergraduate program. Most of our students have to spend 3 to 4 years at the undergraduate level taking care of those prerequisites before then starting the veterinary medicine program. And so that's where I think Brady, Colby, and Kaysen, you said you almost hit the nail right on the head. Approximately 8 years that you're looking at going from a high school graduate to being a VVM graduate. 7 to 8 years depending upon your undergraduate tenure, but that's about 3 to 4 years as an undergraduate student completing those prerequisites, and then 4 years in a professional veterinary medicine program. And that's where during that 4th year, something that I wanted to mention earlier, or I wanted to come back to, was that during that 4th year spent in the clinical rotations here as a part of the DVM program, that's where individuals will have the opportunity to sit for what is called the NAVLE. It's the North American Veterinary Licensing Examination. To be a board certified and practicing veterinarian here in the United States and several Canadian provinces, that's where you have to successfully pass those exams that cover a wide array of topics as it relates to veterinary medicine. And so you take that halfway through your 4th year, so that way you get your results back and you wrap up your 4th year, and then you'll know if you will then have the opportunity to be able to be a licensed veterinarian here within the state of Kansas. So that's kind of what the time frame looks like from that perspective. So yes, I know the VetMed website, because of everything happening with COVID-19, it kind of directs to the veterinary diagnostic laboratories, which we're able to offer coronavirus tests here within this facility. But that's where it's kind of redirecting that now, but that's where, yes, there are pre-vet programs that are offered through the College of Agriculture here at K-State, as well as to the College of Arts and Sciences. So popular pathways include animal science in the College of Agriculture and biology in the College of Arts and Sciences. But we've had graduates from programs as far and wide as chemistry, business, and engineering that have been admitted to our program. But those pre-vet programs are great ways to ensure that you meet all the requirements and gain some unique experiences along the way that can help bolster a competitive application. Okay, well, I think we have, those were, I hope that we got through all the questions, but that's where I want to take just a few moments to be able to kind of cover a little bit of a case study, just so we can kind of start thinking about that critical thinking, that analytical thinking process as it relates to putting yourself in that environment, putting yourself in that position of connecting with both a client and a patient. So kind of a classic example that we'll cover, and then I should be able to get through this, and we'll have just a few moments at the end if there are any other questions that I can cover. I'll also have some contact information that you can be able to jot down to be able to reach me directly in case you have questions that, if you weren't necessarily as comfortable asking that in this arena, I understand. I think there's about 70 participants that are on the call here. So if you want to be able to follow up with me after today, you can be able to certainly do that. But so in talking a little bit about some of the case study that I wanted to be able to kind of cover for you here today. So the case example that we have is a 6-year-old Jack Russell Terrier by the name of Chuffy. And Chuffy was brought in to the hospital by their owner after regular vomiting for approximately 2 days. And so as the vomiting had started, the client had mentioned that they had been out of town for a couple of days, and that when the client returned, Chuffy was left unattended for several hours out in the backyard. Now, it was noted by the client that Chuffy normally has no trouble eating large quantities of food, but for the past couple of days has had a pretty severe lack of appetite. Now, Chuffy is vomiting approximately every 4 to 5 hours, and it's mostly bile that's coming up when Chuffy does indeed vomit. And as a part of the patient history, we know that Chuffy is updated on all vaccines, including heartworm. So that's just kind of a brief history of this particular case study that we are taking a look at. So we're taking a look at what the patient presents, as well as some of the results of the tests. And so during the examination, Chuffy is active and playful, even robust, and shows no signs of nausea. Temperature displays normal auscultation of both the heart and the lungs. And through these kind of initial observations, it would appear that Chuffy did not appear to be in distress. And so a variety of different tests were run. Both the parvovirus and the CPL came back negative. Internal blood screen and complete blood count were, what that acronym means is WNL. It's within normal limits. So there's really nothing that's coming out there. However, from the radiographs or the x-rays that were taken of the abdominal section, we do notice that there are some abnormalities as it relates to those abdominal radiographs. So that's something that would kind of stand out as it kind of relates to some of these different components that we're taking a look at. Some of those, those usual suspects that we're starting to round up, that one kind of stands out in terms of those abnormal radiographs of the abdominal section. So in terms of discussion points, where we've gotten to at this point, as an effective veterinarian, this is what our students learn as they work towards becoming graduates. And that's kind of working towards what next steps do you believe need to be taken going from this point forward? What kind of follow-up questions may you have for the client? Does it appear that the client has been completely transparent? Does it appear that they might be hiding something? What are ways that we can effectively communicate with this client to maybe get a more complete history of the patient and what's been happening recently? It's looking at what do you believe may be at the root or the cause of the abnormal abdominal radiographs, and then looking at the whole picture. Is there any other information that would be able to be helpful to have to come up with an effective diagnosis of what may be causing Chuffy to be able to vomit regularly every 4 to 5 hours. So those are some of the discussion points that you kind of want to start to think about as it relates to that critical and analytical thinking process. So then we can tell you that as a part of the treatment, Chuffy was given a dextrose drip and 850 milligrams of the antibiotic cefalozin. So that's where cefazolin. So I've been having trouble with my pronunciations all morning. So that's where, in addition to those medications, Chuffy was put under hourly monitoring and thankfully showed no signs of vomiting after the treatment began. And so by constant observation, we were able to notice foreign bodies were moving throughout the small and large intestine, eventually moved to the colon. When it was moved to the colon, Chuffy was taken on a nice long walk where he had a significant bowel movement. And after monitoring the fecal matter for foreign substances, found 2 Pepto-Bismol tablets that the client was able to eventually agree that she gave to Chuffy, thinking that it would help, and forgot to mention it during the patient history. So Chuffy was given a variety of fluids and other medications. Chuffy was thankfully able to make a full recovery. And so that's where, when we think about the analytical and problem-solving mentality that we take as this approach, is that within canine patients, foreign bodies causing obstruction can be fairly common. And it shows us the importance of being able to take an accurate history working with the client in terms of communication and providing the most effective treatment possible. So I know that's just one of a example of a number of different cases that a veterinarian may see across their career, but it shows the importance of being able to work with both client and patient to be able to come up with the most effective treatment possible. So with that, I know this is kind of the last slide of my presentation here this morning. Again, I've got the chat up, so if there are any 11th hour questions that I can be able to address. Otherwise, please be sure to jot down our contact information here. That's the email address to be able to reach me directly. That's dfhoffman@vet.k-state.edu. And then we've got the phone number there. I'm in the office here today, but truth be told, that email is going to be the best way to get in touch with me with any question that you may have. I know that the prospect of looking towards a veterinary medicine program can sometimes seem a bit scary or overwhelming, and I'm here to make sure that that process is transparent as possible so that we can help you prepare for a career and an education within veterinary medicine. So with that, I'll continue to kind of keep an eye on the chat, and I'll be here to answer any questions. But again, thank you all very much for joining me here this morning. I hope you were able to learn a little bit more about opportunities inherent to the field of veterinary medicine, different career pathways that you can take, as well as some of the components to think about as it relates to the critical and analytical thinking approach of diagnostic medicine within the field of vet med. So thank you again. I'll keep, okay, Brady told me, what was wrong with Chuffy? It was abdominal obstruction. So that was, in addition to the obstruction, it was the Pepto-Bismol tablets that was not exactly aiding the obstruction. And so they were able to push fluids, able to remove the obstruction, and Chuffy was as fit as a fiddle after that. So always consult your veterinarian is the kind of the case from that standpoint. So Julie, what is the easiest way to get a vet career quickly? And are there online courses from K-State? So a really good question. I would say that there's really not a way to obtain it quickly. There are students that along a pathway can end up, and what I'll do here is, has everybody had the opportunity to, if everybody's had the opportunity to jot down my contact information, I'll leave it up for just a few more moments and then I will turn it back over to my camera. But I would say that there are some students that there are some students that will go through a pathway, especially if they go from high school directly here to K-State from an undergraduate and then are admitted to the veterinary medicine program. So those two links that were kind of for Ann to provide. So those two links are to programs where students can be able to what is called retroactively getting their bachelor's degree. So in a total of 7 years, they can go from high school graduation / start of college to getting their DVM. And so what that means is they spend 3 years as a undergraduate student, and what they can do is in one of those pre-vet programs, especially through animal sciences in the College of Agriculture, they can work towards their degree. And if they're admitted to the veterinary medicine program, after 3 years in the undergraduate program, they can transition from undergrad to the professional vet med program. And then halfway through the 4-year vet med program, so after the first 2 years of vet med, they will retroactively get their bachelor's degree from the College of Agriculture, and then 2 years later have their DVM from K-State Vet Med. So in a span of 7 years, you can be able to complete your bachelor's and get your DVM. So I would say that's probably one of the quickest pathways from that perspective in terms of going from graduating high school and starting college to having your doctorate in veterinary medicine. Yeah, so what does it look like if you go to another school first then? So you can absolutely, so since we don't require a bachelor's degree to be admitted to the program, we do have students like the one that I had mentioned, Jason. He spent 3 total years in undergraduate completing the requirements before starting here in the program. So he spent his first 2 years out of high school at Hutch Community College before wrapping up his classes for a year here at K-State as an undergrad, and then made his way into the veterinary medicine program. So I would say that as long as an institution is accredited, we will accept its classes. And if you ever have questions about, I'm looking at taking this class from Garden City Community College or Butler County Community College, or I'm looking to go to Wichita State or Fort Hays State University, we have plenty of applicants from all of those different programs. So we can work together to make sure that you're taking classes that will fulfill the requirements to work towards eventually transitioning from undergraduate to the veterinary medicine program. Great question. Yeah, so for those of you that are taking classes during high school, whether it's like through dual credit or advanced placement, so yeah, as long as you get college credit from an accredited institution, that'll absolutely count. So for example, in my high school, I took a dual credit class where a community college in Kansas City gave me college credit for that. So it was my English 1 and 2. So I got English 1 and 2 taken care of, as well as my senior year of English there at the high school. So that's where, as long as you get credit from an accredited college or university as a part of those dual credit high school or AP classes, we can definitely accept those to help fulfill the prerequisite requirements. Okay, Emma, really good question. What aspect of vet medicine is growing the most right now? I would say it's a combination of small and large animal medicine, truth be told. I would say that mixed medicine practitioners is the area that's growing the most, just because there are people moving out to parts of the country and parts of the world where they may have companion animals and large animals. So they may have cats and dogs in the house and horses out in the barn. And so being prepared to be able to effectively work with both large and small animals is definitely in demand for individuals that will move out to communities where they may have the opportunity to work with a variety of clients and patients. And so that's where, if you don't want to necessarily focus on something as specific, working towards being a mixed medicine practitioner would allow you to be able to work with a variety of patients and clientele from that perspective. So to answer your question, I would say that mixed medicine practices, those are what's growing exponentially. And then Julie, you had a question about, are there ways to take online classes when you are homeschooled? Yeah, absolutely. Either K-State or lots of other institutions, you may want to look into a local community college that offers online classes as well. As a part of our veterinary medicine program, again, as long as an institution is accredited, we will accept its classes, whether it's that traditional in-class style or whether it's online. So if you have the opportunity and it's more convenient to take those online classes, please know that that won't be counted against you, that it'll be accepted just as it would if it were an in-person class. We want to make sure that we accommodate the students' needs. And if that means online classes to fulfill those prerequisites, then we will accept those classes to fulfill those prereqs. Okay, well, I think we've reached the top of the hour here. Any other questions that I can answer about veterinary medicine at this time? Okay, well, I'll hang around here for just a few more moments, but also just be sure to, if you have questions after today, give us a call, send us an email, anything whatsoever, and we can get you taken care of. So looks like a few more questions that are filtering in here. Can you do undergraduate classes in vet school at the same time? Unfortunately not. It's unlike high school where you have like that dual enrollment high school and college classes. Unfortunately, the vet school classes are for those within the DVM program. So it's kind of two separate educational experiences from the undergrad to the veterinary medicine program. So they're kind of separate from that standpoint. Grad classes, yes, though, there are dual degrees where we have students that will get their DVM in addition to a master's degree, or a DVM in addition to PhD for those that want to be able to conduct research or do experiments or research from that perspective. So yes, there are opportunities to do graduate classes through a master's or a PhD program in addition to the DVM. And Lily, you had the question about, are in-person classes more valuable than online classes to employers? I don't believe so, especially as it relates to our admissions process. We're not going to weigh it one way or the other, especially knowing what the educational landscape is going to look like over the next couple of years. We're going to provide the same amount of value to in-person classes as we do with online, just because we want to make sure to accommodate to student needs during those times. And so if taking an online course was the best fit for them, we don't want to penalize or punish those students because of making that purposeful choice that may have been the best for them at that time. And then Emma, you have the question about, can you specialize in those different areas? Absolutely, you can. That's where you're probably looking at the 4-year DVM and then a 2 to 3 year residency experience, where you would then take a specific set of board examinations focusing on cardiology, oncology, radiology, ophthalmology, dental work, orthopedic surgery. So you would be a resident working under a board certified specialist. You'd sit for a specific set of board exams after a certain amount of time, and then you could be a licensed practitioner within that specific area that happens to pique your interest. So yes, absolutely you can, like you would within human medicine. Great question. Okay, any other questions that I can address? Okay, well, again, thank you all very much for your time. I appreciate you getting up early on a Friday morning to be able to bring great questions, and I appreciate your attention. And with that, if you do have any other questions after today, don't hesitate to call or send me an email, and I'll be happy to get those squared away. But yeah, and we'll catch up here in the not too distant future.